Welcome back to the second half of NewsBreak Live, and joining me tonight is Gastroenterologist James Sattler from Torrance Memorial Medical Center. Thanks so much for joining me.
Thank you for inviting me.
March marks National Colon Cancer Awareness Month, and you've been practicing in this field for over 20 years in the South Bay. Tell me why this month is so important.
It's very important to get the word out as to how screening for colon cancer can save lives. And in much the same way that mammography saves many lives for women, colonoscopy should really be viewed in the same way, as well as other options for screening for colon cancer.
And colorectal cancer is the second leading cause of cancer death among men and women in the U.S., but it's also the most preventable type of disease. Is that true?
That's correct. The majority of colon cancers come from benign colon polyps. And if people undergo either colonoscopy or perhaps a CT scan, if they're unable to undergo a colonoscopy, these polyps can be identified. And if they are always removed, and in so doing, that eliminates the major cause of colon cancer. Unfortunately, all colon cancers don't come from these polyps, but the vast majority do.
What are some of the signs? Are there some symptoms that people can detect that maybe they have this disease?
Unfortunately, if a patient has polyps, there are no symptoms. If a polyp begins to grow and does not stop growing, it will eventually grow into a malignant polyp, which also doesn't cause any symptoms. And then as the malignancy involves the entire polyp, it begins to grow into the wall of the colon, and at that point it would be a typical colon cancer that could not be cured by simply removing the polyp. And at that point, eventually people will develop symptoms. Symptoms can be commonly rectal bleeding, perhaps a major change in bowel habits, at a much later stage, a significant change in weight or abdominal pain.
For viewers at home, if they're not familiar, what is a polyp?
A polyp is a growth that is attached to the wall of the colon. Polyps come in different sizes and shapes. Many polyps are like a drumstick, where the arm of the drumstick would be attached to the wall and the head of the drumstick is what protrudes into the lumen. Other polyps are very flat, and some polyps are very small and difficult to see.
And the way to prevent colon cancer is to stay updated with screenings and colonoscopies.
That would be the best way. There are other dietary factors. Most people feel that a high fiber diet helps reduce the risk of colon cancer. Avoiding excessive red meat is a potential risk factor. Heavily charred meats also. There are some protective factors that may come from using aspirin. Low-dose aspirin has to be taken for a long time before it becomes protective, at least 5 years, but that is probably worthwhile doing.
And I know we were just playing video, viewers are probably wondering, of a huge colon, and that 10-foot tall colon is actually making a stop tomorrow at the Torrance Memorial Medical Center, and it's such a great event to spread awareness. I believe it's sponsored by Bayer.
Correct.
And the Colon Cancer Alliance has this big colon that travels across the country. Tell me about this unique event that's happening tomorrow.
Well, there's a major push to increase screening among the general population. Over many years, the screening rate has been at about 60%. So Torrance Memorial has teamed up with the American Cancer Society to have a goal of increasing the screening rate to 80% by 2018. And one of the ways to help accomplish that is with this gigantic colon that actually I've never seen. I'm interested to take a look. But it will make the colon, various diseases of the colon, a polyp, a colon cancer, much more understandable and visible for people, so that hopefully they'll be encouraged to go ahead and undergo some type of screening process so that goal can be reached.
And I know recent statistics show that 23 million Americans are not up to date on this type of screening. So, and because of that, there will also be a mini health fair where about the first 200 people who attend this event will receive free kits. Tell me about that.
One of the options for screening, other than having a colonoscopy, is to do stool testing.
Okay.
Colonoscopy is considered to prevent colon cancer because it's the best way to detect polyps and the only way to remove polyps. And if polyps are not present, then the risk of colon cancer is much, much lower. But there are other tests that are designed primarily to detect a colon cancer if it's present or a very, very large polyp. And those tests are generally stool tests. They are simple to perform. The test that's going to be available is called a FIT test, which stands for fecal immunotesting, and it is a way to test for the presence of human blood in stool. And that is easy to do, can be done at home with a very, very small stool specimen that then gets sent back to the laboratory. LabCorp is going to analyze these stool specimens free of charge, and then people will be notified by Torrance Memorial if the stool test is positive. If someone has a positive stool test, that doesn't mean that they have colon cancer. That doesn't mean that they have necessarily a large polyp, but what it does mean is that they should undergo colonoscopy.
Okay. So there'll be this great interactive exhibit, there'll be a mini health resource fair, and a health lecture which you'll be speaking at. So tell me about some of the topics the lecture will touch upon.
Well, there actually will be several physicians speaking, talking about different aspects. Dr. Tony Lee is a gastroenterologist who will be speaking on risk of colon cancer, prevalence of colon cancer, and various screening guidelines. I will be speaking about the various options for colon cancer screening. Dr. Malayuraj who is a surgeon at Torrance Memorial that specializes in colorectal surgery, will be talking about new advances in surgical techniques. There will be an oncologist speaking as well about advances in chemotherapy, and also a physician from the radiation therapy department at Torrance talking about newer techniques in radiation therapy.
This event sounds like such a great platform to spread awareness about colon cancer, but you see patients every day, and what are some of the risks that are related to colon cancer? Is it genetics or is it the way we eat?
Probably the most important risk factor is if someone is known to have what's called an adenomatous polyp. Not all colon polyps are ones that can potentially grow into a colon cancer,
Okay.
but adenomatous polyps are very, very common. So the majority do not grow, but some certainly do. Probably 15 to 25% of women have polyps. Anywhere from 20 to 25% of men have these polyps. So if you are known to have had one of these polyps, it's very important that you follow up with routine screening, which is at shorter intervals than people that don't have polyps. The other major risk factor is one's family history. Mm-hmm. It predominantly relates to first-degree family members who have had colon cancer, especially at a young age. The younger the age that the relative has been diagnosed with colon cancer, the greater the risk for the first-degree relative. So first-degree relatives are either your mother, father, brother, or sister. If a first-degree relative has a history of adenomatous polyps, that also is a risk factor. And people in this group are generally followed at 5-year intervals rather than at 10-year intervals for someone who has no risk factors and no history of adenomatous polyps.
What is the minimum age for someone who does not have any risk factors and should take a screening?
Beginning at age 50.
Okay.
That is the age, and then earlier for those people that do have a family history. Okay. And of course, if people have symptoms that warrant investigation, the colonoscopy would be done at any age.
Earlier we mentioned that this disease is preventable. So what are some steps people can take, some steps our viewers can take Is it exercise? I know you mentioned a better eating habit.
Unfortunately, it's not completely preventable, but certainly by, first of all, having a colonoscopy, exercise is felt to be beneficial. Eating minimal amounts of processed meat, red meats,
Okay.
charred meats, and perhaps using aspirin. Other options such as taking calcium, magnesium, vitamin D. Garlic has been mentioned by some people, folic acid. These have not been definitely proven to be beneficial.
And we were just talking about screenings. What do you look for during a screening as a doctor for people to get an idea of what the screening detects?
When we do a colonoscopy, we are inserting the scope through the colon, and we are essentially looking at a TV monitor that is a very, very high resolution monitor. There are always other personnel in the room, so there are at least 2 sets of eyes looking at the colon while we're doing the procedure. And we're essentially looking for small polyps. As I mentioned, some are very easy to see, others are more difficult. We're looking for changes in color in the wall of the colon, any areas of inflammation, abnormal blood vessels are the major things that we're looking for. Any polyp that we see, we remove, because the ultimate diagnosis of an adenomatous polyp is made by the pathologist, and we cannot tell for sure by looking at it.
So as a doctor, what steps can people take for viewers at home that are watching this? What are some services at Torrance Memorial Medical Center that can help people take those first steps to see if they're at maybe higher risk for colon cancer?
Probably the best first step is to talk to your primary care physician,
Okay.
who can then ascertain what your symptoms are, if there are any, what the various, what the family history is, and then with your primary care doctor, an appropriate screening plan can be arrived at, and if it's ultimately decided that colonoscopy is the recommendation, then they would be referred to the gastroenterologist in the community. If the patient and doctor think that stool testing is more appropriate, that would be done with the primary care physician. I would like to also mention that there are some very uncommon familial genetic cancer syndromes. Those can be identified with the primary care physician and really aren't a topic for general discussion today because they're not that common.
This information has been so great, and tomorrow people can come out, talk to you, and check out the great exhibit that will be there. As a gastroenterologist, why do you hope people will come out to this event?
Because unfortunately, as gastroenterologists and having practiced for many years, we do come across people who choose not to have a colon cancer and then several years later come back with a symptom. We do the colonoscopy and they have a colon cancer. And it's always very disappointing, of course, most so for the patient, but for the doctors and nurses, that had they had a colonoscopy several years prior under a screening regimen, that colon cancer could likely have been prevented. So to get the word out, to do some type of screening, either colonoscopy or stool testing, ultimately saves lives.
And it's one step to prevent yourself from getting it, of course.
Absolutely, the most important.
Well, Dr. Sattler, thank you so much for joining me tonight. It was a pleasure.
Thank you for having me.
And we were talking earlier about the details for the event tomorrow. It will take place at Torrance Memorial Medical Center. From 5:30 to 9 p.m., you can walk through the 10-foot tall giant inflatable interactive colon. There will also be a mini health resource fair with screening tests for pickup at 5:30 through 7 p.m., but that will only be for the first 200 attending. Then there will be a health lecture on preventative measures and treatment for colorectal cancer, and that will all take place at Torrance Memorial Medical Center at the Richard B. Hoffman Health Conference Center. Well, that does it for NewsBreak Live. City Council has the night off. If you ever have news or video that you'd like to share, please email us at newsbreak@torranceca.gov. And for Facebook and Twitter users, use #NewsBreakLive. We'll see you next time. Have a great night.